Hello, my name is Tyrone. I am 57 years old and I work as a deputy probation officer in Los Angeles, California. In 2005, an ophthalmologist discovered swirl patterns in my mother's cousin's eyes during an examination. That ophthalmologist was aware of the relationship between this sign and Fabry disease. A referral to Emory University later led to a diagnosis for Fabry disease, and in January 2006, Emory University informed my family members that we may suffer from Fabry disease as well. At that point, most of us took no action. Only a few relatives decided for testing, including my mother and another cousin. They were both diagnosed with Fabry disease. My mother's cousin was amongst the first in my family to receive treatment. My mother, who was diagnosed with stage 3 kidney disease and hypertension, decided against treatment. Later, when my aunt passed away from a brain aneurysm related to Fabry disease, I decided it was time for me to have a test. I was initially diagnosed with Fabry disease in 2009. I felt like this diagnosis was a death sentence because I knew little about Fabry disease and had family members who were sick and dying from complications of Fabry disease, but none of them were in treatment. In December 2022, Dr. Rastogi confirmed my diagnosis. Then a nurse provided me with information regarding kidney disease and Fabry disease. I began treatment in September 2023. At this point, only two of my cousins received treatment as well. Looking back into my family tree, I believe that my great great grandmother had Fabry disease because she died at an early age. She may have passed it to my great grandfather, who afterwards passed it to my grandmother and to my mother and to other relatives who were always sick and dying at early ages from heart attacks or kidney failure and other conditions. When I was 8 or 9 years old, I suffered from lots of headaches and dizzy spells, and because of this, my mother took me back and forth to the hospital. But doctors at that time were unclear of why I was sick. Looking back, I realized that this was related to Fabry disease. As an adult, I suffer from hypertension and angina and have swelling in my lower extremities, symptoms which were also experienced by other family members. My initial care team included a PCP, a cardiologist, and a nephrologist. Although I was first diagnosed in 2009, my care team had no experience in management of Fabry disease. Initially, my cardiologist performed angiograms and found no issues with my heart and encouraged lower fluid intake for the swelling. My nephrologist was concerned about my declining kidney function and the swelling in my lower extremities as well. For this reason, he referred me to Dr. Rastogi. In 2022, Dr. Rastogi initiated specific treatment for Fabry disease. Later, my patient education liaison, who also assisted my aunt who died of an aneurysm, informed me that I may suffer from left ventricular hypertrophy. He encouraged me to discuss this with my cardiologist. In 2023, my cardiologist performed an echocardiogram and confirmed a diagnosis for left ventricular hypertrophy. In addition to treatment for Fabry disease, my care team manages my health through prescription medicines. And I also observe a vegan lifestyle and avoid sodium, phosphorus, potassium, and animal protein. I now have a better perspective on Fabry disease and the way I face life. I encourage physicians to learn more about rare diseases, to closely follow up on the concerns of their patients, and to consider reaching out to referral organizations for advice and education. I'm grateful for specialists like Dr. Rastogi and my care team for preserving my life and guiding me through this journey.